Police say mental health calls are rising in the community and in classrooms. Each year, hundreds of children are involuntarily committed to mental health facilities in Austin. Under Texas law, only two people, a judge or a police officer, can decide to issue an emergency detention like that, and neither need parents' permission to do it. The goal of the law is to help families in a mental health crisis, but some of those families tell investigator Kelly Wiley they want other alternatives.
When Marie Sheasley's 13-year-old daughter said she thought about overdosing on Tylenol, her first thought was where to turn for help.
I immediately thought, let's get into action and start calling some mental health professionals, none of whom were open.
Sheasley says she was advised to go to a hospital in Austin, where she hoped her daughter could talk to a psychiatrist. Instead, Sheasley says the hospital had her daughter speak with the police officer alone.
I'd lost all parental power, and my child, I'm getting upset just remembering it. My child was being taken from me and brought somewhere I've never seen. I don't know who's handling anything. I didn't get to research it. Just, she was being taken from me. Right then, right there.
Sheasley's daughter was taken to a crisis facility on what's known as a peace officer emergency detention. Disability rights senior attorney Beth Mitchell handles cases like this every year. She says emergency detentions should be a last resort.
Really, it's a huge loss of liberty, and you know, I think that a lot of times it's used inappropriately, where people potentially could remain in the community with supports and services. I don't think that they realize that this can happen to a minor, to their own child.
In Austin, most emergency detentions happen without a warrant. Officers can order an emergency detention regardless of age if they believe there's an imminent risk the person will harm themselves or others. Since 2017, more than 1,500 minors in Austin have been involuntarily committed on police orders. More than 90% were ordered by the Austin Police Department.
Do you think the law around peace officer emergency detentions is working for kids?
What the legislators decide to pass, we work with. I mean, it's working for our officers to give us a tool to at least get somebody into that initial door to be seen by a doctor to make the determination on if they need further psychiatric care.
In Texas, the only mental health course required for every new police officer is 40 hours of basic crisis intervention training. A different course for mental health officer certification focuses on emergency detentions, when they're appropriate, and alternative plans that don't require committing someone. But that course is still voluntary. APD's goal is to get all of its officers certified by 2022.
1347, I'm in the area.
Another local agency, the Austin Independent School District, has already made that move.
We got a parent, possibly a parent with children on campus.
Austin ISD Police Sergeant Wayne Sneed is over the school district's mental health unit.
Every officer should be certified. When you look at just the statistics on mental health calls, we have never declined in our calls for mental health services, not 1 year. But yet, we still don't have the training, officers out there with the proper training and tools, not their fault all the time, to make those decisions the way that they need to be made. Then it's a recipe for disaster.
The only thing, Kelly, that was going through my mind was how much training did this mental health officer get to make these judgments?
Sheasley says after 2 days in the facility, she took her daughter out and had her start therapy 3 days a week.
There was a lot of work that we had to do, but we did it.
How is she doing now?
She's doing great. It's a fine line between who you have to pluck and put away and who you don't. I'm not a professional, I can't make that call, but in my situation, they made a bad call. And it really left my daughter traumatized.
Right now, APD policy only allows its crisis intervention officers to order an emergency detention on a person. All of their CIT officers have that additional mental health officer training that we mentioned in the story. Officers without that training must first identify a mental health crisis and then flag a CIT officer. But keep in mind, in Texas, police aren't legally required to consult with mental health professionals before they make these decisions.
Is it happening in Austin?
Well, APD does work closely with Integral Care, but their CIT officers aren't necessarily paired with them on every single call. We know in larger cities like Houston, they have taken that step.
What can parents do in a situation like this, Kelly?
Well, we did talk to Integral Care about this, and they say if your child has suicidal thoughts, their 24/7 helpline is a good place to start. They say they can help you navigate the situation as parents. They can even send a mobile crisis outreach team if you're in need of in-person support.
Yes, and we have their number in this story in the Texas Politics section of our website. And if anyone is at risk of harming themselves, call 911 and press 4 for mental health services. Thanks, Kelly. Out from behind bars, earning an honest living, reconnecting with family, but it could all be taken away.
So how do you feel about the thought that maybe soon you might have to go back to prison?
I don't really think about it. It would be crazy. I don't want it to happen. I'm hoping and praying it don't happen.
The number of people let out of federal prison to stop COVID and what it's like for those who've yet to go back.